heroic efforts that change that curve. God bless America, but don't underappreciate what you just did, and don't go backwards. That would be a real mistake.
Mine's a three-parter. Basically, weddings, funerals, and the president. So weddings, this push about, I don't know, maybe you can clarify about clerks only being able to marry people now that you're allowed to marry again. Secondly, efforts to alleviate bodies coming into funeral homes. And thirdly, just your faith in the president moving forward.
I've taken a lot of actions during this period of time. The action that probably has caused me the most amount of grief is what I said about marriages. Marriages you can now do, you can get a marriage license online, and we've authorized marriages online by any licensed or legal official who can perform a marriage. So I said yesterday, well, no one has any excuses anymore, right? Now it's a simple yes or no. Will you marry me? Simple yes or no. You lose all those possible excuses. Well, I have to set a wedding date. I have to do this. You can do it tomorrow. It's all online. You can get your certificate. You can get your license. You can do it online. A judge can do it. Any official can do it. So there's no excuses anymore. Yes or no. Will you marry me? I got all sorts of bad, ugly comments about that. Melissa, well, I'll ask her about if she knows anything new about funeral homes. Do I have faith in the president? Look, what the federal government did, working with states, as I just said, was a phenomenal accomplishment. We bent the curve. We flattened the curve. Government did it. People did it. But government facilitates people's actions, right? We had to double the hospital capacity in New York State. That's what all the experts said. President brought in the Army Corps of Engineers. They built 2,500 beds at Javits that Michael and Northwell were operating. It was a phenomenal accomplishment. Close to 1,000 people have gone through Javits. Luckily, we didn't need the 2,500 beds, but all the projections said we did need it, and more, by the way. So these were just extraordinary efforts and acts of mobilization. And the federal government stepped up and was a great partner, and I'm the first one to say it. We needed help, and they were there. State and local governments were fantastic. The hospital system was fantastic. New Yorkers were fantastic. And that is an undeniable fact. Just to look at what they said was going to happen, CDC, Coronavirus Task Force, Cornell, McKinsey, all of them, and they had a line up here, and the actual line is down here. What do you owe the variance to? Heroic efforts on behalf of people as facilitated by government, federal and state. So that was phase one. Now we have to go forward to phase two. Big challenge is going to be testing. It will not be done perfectly. We can't bring it up to scale in this period of time. I will tell you that. But we can do better working together than working apart. And that's the federal-state partnership. I will do my part as a governor. I know the other governors will do their part. Federal government is involved in testing. They had a whole presentation at the last presidential briefing. We have to work together and do the best we can. And we will. And I have faith that we will, because we have in the past. You know anything funeral homes?
On the funeral homes, the governor signed an executive order to allow funeral directors who are either retired or from out of state to be able to be licensed immediately in New York to help with some of the backlogs. On the weddings, yesterday the executive order that we did allowed clerks to perform the weddings remotely, and today the governor signing a new executive order to allow anybody who is licensed to be able to perform weddings to be able to do it, so it won't just be limited to clerks. And on the website, it'll be updated by 2 o'clock today, the COVID website tracker.
I'm also licensed to perform weddings, so I am available for online services, special vows that I do. Did you know that?
I would have assumed it.
Let's take one more question.
Just to follow up about the president, and I have one other unrelated question. He tweeted during your press conference that he was right on ventilators, and now he's right on testing. Governors must step up and get the job done. We'll be with you all the way. Did you speak with the president recently, today, yesterday, about this, and has there been any forward movement with getting more reagents for the diagnostic testing?
We have been talking about, I haven't had a conversation with the president in the past day about this, but we've had conversations about it, and the president is right. He's right. States have to do what they have to step up on testing, and the federal government has to step up on testing. Federal government is involved in testing, and they did a whole presentation at the president's briefing on testing and what they're doing on testing and what they're doing on helping the supply chain, et cetera, and that's great. And between the states working with the federal government, we will do the best job we can. What was the president's tweet exactly, just so I'm responding to the right thing?
He said, just like I was right on ventilators, our country is now the king of ventilators. Other countries are calling, asking for help. We will. I am right on testing. Governors must be able to step up and get the job done. We will be with you all the way.
We will be with you all the way. Great. States must do their part, and the federal government must do its part. Perfect. That's what's called partnership. I agree.
And just as a follow-up on the testing, I know that initially there was some rationing of the diagnostic testing. What is it going to look like for the antibody testing? Who's going to be getting those, and who will be able to get the antibody testings once that gets ramped up?
The antibody testing that we're doing now this week is a random sample. So it's not like testing where somebody can ask to be tested. It has to be a random sample that is conducted throughout the state. Thousands of people get tested. So we know this percentage of the population had the antibodies. That is not a test where a person can call up and say, I want to be tested, or go to a place. That has to be done on a random sample basis. In terms of the antibody testing being added to the diagnostic testing, we now have an antibody test that the state can perform. We can do about 2,000 tests per day for the state. That's about 14,000 per week. Sounds like a big number. It's not that big a number in the total context of a state of 19 million people. Also, when you talk about testing, just to give it a relative proportionality, we have tested in this state more than any state in the United States. We have tested more than any country has tested, okay, on a per capita basis. So nobody is better at testing than we are. With all the testing we've done since this started, 500,000 tests. Wow, it's a lot. Not really. It's been a month and we did 500,000. At that rate, this goes on for 3 months, we would have tested 1.5 million people. We have 9 million people in the workforce. We have 19 million people in the population. So we have to increase that rate. And that's why the partnership with the federal government to get the reagents, et cetera, is so important. And that the federal government provides the states with resources to do this. I mean, you have the president saying 15 times, it's up to the governors, it's up to the governors, it's up to the governors. And then they're going to pass a piece of legislation that gives, you know what, to states? Zero. Zilch. Nada. Niente. Whatever language you want to say it. Nothing. But then how are the states supposed to do this? And then what, you know what happens? I'll tell you exactly what happens. The state now has about a $15 billion deficit, somewhere between $10 and $15 billion deficit. I'm going to have to, I don't have any funding to do what I normally do. I normally fund schools. You'll see a 50% cut in education. You'll see a cut to hospitals in the midst of all of this. I give local governments aid. They pay the police officers. They pay the firefighters. They pay the bus drivers. public transit. Those are the essential functions that are now working. How can you not fund that? Well, we want to fund small business. Great, fund small business, fund the airlines, fund whatever you want. But how do you not fund the state government that you know is in charge of reopening this entire nation, right? So we have to be smart. I want to thank Michael Dowling again. I want to thank Northwell and all the people, not just for today's hospitality, but more importantly, for all the beautiful work that they have done. Thank you very much.
Hospital funding by 50% and raise taxes. You have the ability to do rolling cuts. Does that include no more raising taxes?
If the state budget adjusts to what the federal government does and the overall revenue.
So why didn't you increase the overall revenue?